people wake up several times a night to pee, and it can completely wreck your sleep. For some, it's only annoying. For others, especially people dealing with pelvic floor issues or prolapse, it can feel like the bladder is in control instead of you. Hi, my name is Jessica Babich, and I'm a doctor of physical therapy practicing in New York City. So many of my patients struggle with getting up to pee at night, and it can be really frustrating. Waking once at night can be common for so many people, but waking up multiple times is considered nocturia and often means the bladder or habits need retraining. The good news is that 4 simple changes can make a real difference. Here are 4 tips that help many people sleep longer and wake up less. One helpful place to start is with bladder irritants. A bladder irritant is a certain type of food or drink that makes the bladder more sensitive, especially in the evening. Caffeine, alcohol, carbonated drinks, artificial sweeteners, citrus, spicy foods, and even chocolate can irritate the bladder lining and increase urgency. Many people have wine, dessert, or a flavored drink at night without realizing it might be the reason they keep waking up. Cutting irritants after 4 p.m. can calm the bladder and reduce that sudden urge that hits just as you start to fall asleep. Another key strategy is to manage your fluid intake, especially at night. A lot of people don't drink enough during the day, and then they try to catch up at night, which almost always guarantees more nighttime trips to the restroom. Try to stop drinking liquids at least 4 hours before bed. Staying hydrated earlier in the day gives your body time to process fluids and helps your bladder stay quieter once you lie down. Make it your mission to drink at least 70% of your water needs before noon. Most people hear pelvic floor and automatically think of Kegels. And while a Kegel does have a place as a strengthening exercise, it's not what helps with nighttime peeing, and it's not what most people actually need. For many people who wake up multiple times at night, the pelvic floor is already too active, not weak. Overactive or poorly coordinated pelvic floor muscles can confuse the bladder's signaling, making urgency feel stronger than it is. Instead of squeezing, what helps at night is learning to relax and coordinate the pelvic floor with your breath. A few minutes of slow 360 breathing, pelvic floor drops, and gentle mobility before bed can calm the nervous system and help the bladder signal more normally, so you don't feel the need to get up as often. The last tip is to break the habit of just-in-case pee, or jicking. You may be thinking, but this makes my bladder completely empty before bed. Well, the truth is that if you go to the bathroom repeatedly before bed and try to squeeze out that last small volume of pee, even when you don't feel the real urge, this teaches your bladder to feel full at very low volumes. This makes your body send false alarms that wake you up at night. A better approach is to go once about an hour before bed, then one more time right before lying down. After that, commit to staying in bed. If you feel urge, try some deep breathing to relax your pelvic floor. Over time, this retrains your bladder to wait longer between trips and reduces those constant signals that push you towards the bathroom. These 4 simple habits, avoiding irritants, managing fluids, relaxing your pelvic floor, and breaking the just-in-case cycle can make a huge difference in how often you wake up at night. With consistency, many people find their bladder becomes calmer, their sleep improves, and they feel more in control again. What questions do you have? Drop them in the comments below and I will try to answer them in a future video. If this video helped you feel informed, confident, or more hopeful, hit like and subscribe and share this with someone who you think may benefit. If you live in New York State and would like personalized guidance or to work with me in person or virtually, be sure to check out the links below. I'm Dr. Jessica and I'll see you in the next video.